So, hello everyone, myself Dr. Tejaswini D. Bhat. I am an Ayurveda physician in PRS Neurosciences. So, today we will be discussing about spasticity in Ayurveda, how spasticity can be treated using Ayurveda treatments. So, basically spasticity is nothing but it is a motor disorder. That means it affects the muscles, wherein the muscles will become stiff and rigid, and also it contracts involuntarily. Okay. So, mainly it is seen as a symptom of neurological conditions such as stroke, as a consequence of stroke, as a consequence of traumatic brain injury, even in spinal cord injuries. In all such conditions and even multiple sclerosis conditions, spasticity is seen as a symptom. So, what is the main problem with spasticity is that it will interfere with the daily activities. So, as the patient is recovering, if the spasticity persists, then it will start interfering with the daily activities, even with movement, even with speech. So, there will be many risks or complications which are involved with spasticity. That is, the spasticity will not allow the patient to change the position. So, there are many risks of pressure source happening, or there are also chances of patient going into contractures because of the spasticity, and there is also chance of increased risk of fractures or dislocation happening because of spasticity, as the muscles will become tight and the movement of the muscles is also restricted. So, all these are the problems which comes with spasticity. So, there is a major concern regarding treatment of spasticity. So, coming to Ayurveda, in Ayurveda we have the treatment modalities which help in treating this spasticity or to reduce the symptom and to make the to improve the quality of life, so that these functions which are hampered can be improved. The term spasticity is termed as jadatva, or something which is stuck, which is stiff in Ayurveda. Okay. So, the term which is used is jadatva. So, mainly as we know in Ayurveda there are three main doshas, that is Vata, Pitta and Kapha, which are involved in pathogenesis of any disease it might be. So, but coming to spasticity, the main dosha involved is Vata. So, Vata is one dosha which is mainly causing spasticity, but Vata alone cannot cause spasticity. So, spasticity is usually caused by the combination of Vata with Kapha. That is what is understood, that Vata along with Kapha will cause the muscles to become spastic. Okay. Moving on to the treatment principle basically. So, what happens is that when we are treating Vata and Kapha, we have two main treatment plans, which is called as Rukshana and Snehana. This is the main concept or treatment principles by which we treat Vata and Kapha, that is spasticity in Ayurveda. So, we have two types of treatments, that is Bahya Chikitsa, which is called as external treatments, and we have also something called as Abhyantara Chikitsa, that is internal medications which can help in treating spasticity. So, first one we have, when we move on to the Bahya Chikitsa, that is external treatments which can help in spasticity. There are based on the there are actually different stages of spasticity, not stages exactly, but the severity. Based on the severity, you can consider it as mild spasticity, moderate spasticity and severe spasticity. So, there are different treatment modalities which can be used for all these three different types of spasticity. If the spasticity is of mild kind, usually if it is mild, we will go for external treatments such as Udvartana, that is powder massage. Okay, we have something which is called as powder massage, followed by Abhyanga, that is oil massage. So, this is how we can treat the mild form of spasticity. There is only a joint involved, only a specific joint or only localized spasticity is present, then we will usually go for applying Upanaha. Upanaha is nothing but it is an application of a paste. We make a paste of the drugs which reduce Vata, that is Vatahara drugs are used. We make a paste of those drugs, and by using usually it is a banana leaf or a castor plant leaf, that is we will tie the whole paste, we will apply the paste to that particular region, and then we tie it tightly with a cloth, and that paste is maintained or kept for around 12 hours. So, this is also one type of treatment modality which helps in reducing the local spasticity. Then we have something which is called as spasticity, again if it is persistent to 3 or 4 joints, multiple joints or 3 or 4 muscles, group of muscles, then we have something which is called as spasticity. We use the treatment modality which is called as Churna Pinda Sweda or Valuka Sweda. That is nothing but where powders or mud is heated, it is tied in a cloth and it is made into a potali. Potali is nothing but like a bolus. We make it into a big bolus and then we heat it on a pan, and then we keep on placing it on the affected regions. That is something which is similar to fomentation. So, this is also one type of treatment which is practiced in, for spasticity. And again Moving on to if there is a whole body is affected, like all the 4 extremities are affected, then we have a treatment principle which is called as Parisheka or Kaya Seka. Parisheka or Kaya Seka is nothing but where we pour a hot kashaya, lukewarm kashaya over the entire body. So first initially massage is done for with the respective oil for around 5 to 10 minutes, and then followed by this Parisheka or Kaya Seka procedure, where the kashaya is made lukewarm and it is poured over the entire body for around 30 to 35 minutes. So this procedure also helps in reducing the spasticity of the entire limbs. So it helps in treating the entire limbs together. So apart from this, this is one of the treatments some of the treatment modalities we have. Apart from this, we have a major treatment modality which is called as Basti. Okay, that is Basti is one of the Panchakarma. Again, Ayurveda has 5 main treatment modalities, that is called as Panchakarma, that is Vamana, Virechana, Basti, Nasya and Rakta Moksha. Okay, so major treatment principle, as I was saying, is Basti. So Basti, what happens is that it is a procedure wherein enema is given by using medicated oils and medicated kashaya, usually for a period of 15 days. So this treatment will help in reducing the Vata dosha and thus will help in reducing the spasticity. So we have many cases which we have dealt here in PRS Neurosciences, wherein we have seen a drastic improvement in spasticity based on the treatment modalities which I have explained already. So these are some of the treatment modalities which are helpful in reducing spasticity, and we have seen tremendous results in patients by using these treatments. If anyone is suffering from spasticity, someone wants to get a relief from spasticity, so these treatments can be helpful.